Relax. Can you see your movement? You had great difficulty to getting up.
Yeah.
Can you please sit and get up? You are so fast.
Yeah, overall, I'm happy with the treatment. If they have pain, back pain, leg pain, or neck pain, or whatever it is, any sorts of pain, just come and take an appointment with you and go for a treatment. I recommend that because the way I got a relief. I want other people also to come and have the relief for them without doing any operations or whatsoever.
This is Dr. Rahul Gulve, physio-certified Austrian chiropractor, manual therapist and pain management specialist. Today we are with Mr. Master Francis Mascarenhas, aged about 69 years. He came all the way from Bangalore for his low back pain treatment. So, how is your pain, sir? And from how long you are suffering?
It started about 6 to 7 years back. I fell down from the stairs twice. And later on, I met with an accident, small accident. I fell down from the Activa.
So you have been consulting many doctors?
Yeah, I consulted many doctors. I have done physiotherapies and all the things. And then I went for Ayurvedic massage.
Okay.
And that too, for a short period of time, it was okay with me. But it recaptured again and it started again.
Okay.
So I was having a severe problem with it.
Okay.
So normally I could not climb the bus, so I could not climb, I could not do it. Even my moment while sleeping, getting up, it had become tough.
Okay.
So it was having a lot of problems, or creating a lot of problems.
Okay.
Then I heard about you from one of my friends, and I went to a link and saw all the videos and all.
Oh.
So that's why I thought of coming here for treatment.
So how is the nature of pain? How severe it is?
Severe means the pain at the back is there. It fluctuates towards the left hand side and down on my left hand knees. Okay, and the full body has stiffness.
Okay.
Full body has a stiffness.
So while walking and while climbing stairs, you have problem.
Yeah.
So as per the examination, he is having pain from L1 to S1, central and bilateral. Pain is more on the left side, and it is in the SI joint too. And the X-ray says there is a loss of lumbar lordosis and multiple osteophyte formations are there in his lumbar spine. So we'll start treating him. Yes, done. Yes. Yes. I just mobilize this HI joint. Yes. Yes.
Most of the time I could not walk properly.
Okay.
What was happening when I was walking, and all of a sudden something comes in front of. I was getting a jerk.
Okay.
And when that jerk was there, and I think the getting
compressed.
and compressed. Because of that, the pain just started.
Okay. So how long you used to walk freely?
Normally, I used to walk for about 20 minutes, 25 minutes
Okay.
daily. That was my routine.
Okay.
But later on, it became like after 10 minutes or something comes, I could not walk.
Okay. So your capacity was 10 minutes.
Yeah, 10 minutes.
Okay. So after 10 minutes, you used to have.
Yeah,
pain
this
in
numbness used to come and I could not walk.
Okay.
My body's resistance was not giving me the pressure to walk.
So as we have planned 14 visits, hope we can clear his problem within the planned visits, and we'll take a video and with his improvements. Thank you. This is Dr. Rahul Gulve. So today we are with Mr. Francis
Vascarinus.
Sir, and as we planned 14 visits for his low back pain and sacralization issue, both the legs he had numbness and pulling pain, burning pain. So he has suffered from last 7 years. So today is the last visit. So how is your experience, sir? How is your pain now?
The pain is subsided. Much of the pain is subsided. Consequently, I'm feeling quite better than before. What the stiffness was there in my body, the stiffness has tried to reduce it.
Good.
After my manipulation, and I'm feeling a lot of relief even. And the problem is I could not walk for some time, but now I can walk for a stretch of 40 minutes at a go.
Yes.
Yeah, thank you.
In this age,
Yeah.
40 minutes at a stretch.
Yeah, I'm 69 right now.
Yeah.
So I'm doing my walking and all.
Good.
It's come back to the routine, whatever so left over, it's come back anew to me.
Oh, great.
Yeah.
Great. What about your intensity of pain and the stiffness and all?
Stiffness has gone down, but the intensity of pain is still there. As you know.
Yes,
a
it will take little more time.
Yeah, it will take little more time as it is.
As
I'm
the days
coping with
goes on.
my age. So for this present scenario, it's good for me. Whatever the treatment I got from you,
Yes.
I really appreciate.
Thank you.
Okay, and I would
Yes. What about your quality of life before treatment and now?
not
The
call
movement,
it.
walking.
My movement has been better. I can stand up now without any support.
Before that?
Before that, I needed a support
To stand up.
Yeah, stand up. But now, only thing a little bit turning, twisting is there. But I think gradually after doing my exercises,
Yes.
as you have told me to do,
Yes.
gradually it might come back to normal.
Yes. So you mean to say your quality of life is improved?
Yeah, it's quite improved. Quite
Okay.
improved. Yeah.
Like getting up and walking?
Yes, yes.
Before that, how long you able to walk?
Formerly, the very beginning, that was my daily routine of walking for 40 minutes. Daily routine.
Okay.
And in between, it stopped completely.
Completely?
Completely. Because the time I used to walk little bit, I used to get exhausted.
Okay.
And muscle pulling,
Okay.
thigh pull, cramps were there in my. That's also what I was feeling. Now, nothing of that sort. The cramps have gone.
Great.
I can go at a distance, but not as what is what from slow to medium.
Yes.
That's it. Overall, when I came here, I
Yes.
come from a long place, but
Bangalore.
from Bangalore. Yeah.
From Bangalore.
Yeah. Initially, I had some difficulties,
Yes.
but we are in our life. We have to cope up with all the difficulties.
Yes.
That's what we have to achieve in our goal.
Yes.
Okay,
Yes,
and that I have achieved today. I've gone through a lot of pain, but it's okay with me. I don't criticize or do anything. But overall, from your side, I got a good response.
Yes.
Dr. Rahul, I got a good response, and secondly, from the
Dipti.
Dipti, okay, and your staff.
Yes.
Your staff was courteous, and they were always helping nature. And in that, what makes a man to come out of what he is.
Yes.
You automatically come out because you get that drive and initiative because of their support and the courtesy and they are after you or every now and then. When you feel something, they are helpful. I really try to appreciate what they have done for me, and I'm thankful to you,
Thank you,
to
sir.
all you and your staff, what they have done for me.
Thank you.
Okay.
It is our duty, it is our prime responsibility to do. And you are also very, friendly in nature. So I don't, how these 14 days gone.
Yeah,
simply.
thank you. Yeah, that's just right. I also felt as if I was just come here and go, but I had a very good time, and Prem was there
Prem.
always with me.
Yes, yes.
Okay,
You
we
become
had
his friend.
talks and it was through him that the conversation was going to you.
Yeah.
What is there?
So overall, you are happy with the treatment.
Yeah, overall, I'm happy with the treatment. And last but not the least, I have to thank each and every one whom are forgotten. But I would like people, at least once in a, if they have pain, back pain, leg pain, or neck pain, or whatever it is, any sorts of pain, to just come and take an appointment with you and go for a treatment. I recommend that overall, because the way I got a relief. I want other people also to come and have the relief for them without doing any operations or whatsoever.
Thank you. So, as the age also matters, as he is 69 years old and he is having a severe ossification formation in his lumbar spine, and it is a sacralization. So, majority of the people think that when the L5 and S1 got freeze, as it is a sacralized, when the vertebrae got freeze, the nerve roots which are coming out from the L5 and S1 junction used to compress, and when you are walking, the nerve pain, stiffness starts. As he said that while walking for a few minutes, he used to start developing pain, stiffness in his both the legs. So now he is able to walk comfortably for 40 minutes in a stretch, and that is what the improvement is. But still, as the severity of the problem is more, as it is a sacralization, we could have planned more number of visits, but as he is committed with some other work, his responsibility, so sir has given us only 14 days of treatment time. So within this 14 visits, we could have seen this good improvement, and hope as we guided the exercises, the beautiful exercises, filterized exercises, and the evidence-based exercises, we have guided him. By doing these exercises, definitely the remaining pain कुछ बचा कुचा हुआ है, definitely that also goes up. And how much time you are taking for exercises?
I'm taking about 35 to 40 minutes daily.
Okay.
But here, and once I go back home, I'll be doing once in the morning and in the evening also.
Good. After doing exercises, how you are feeling?
I'm feeling quite relief.
Great.
I'm feeling the pain, what we say, is going down completely.
Yes.
I'm feeling a relief.
Great.
Because when I come back, I'm having that pain. But once I start with the exercises, and my relief is there. I can go forward with all the other, cope up with all the.
Yes. So by doing exercises, definitely the remaining pain that also goes down, because when we are strengthening the structure, when we are mobilizing the structure with different type of therapeutic exercises, definitely the structure used to get strengthened, and we could not change the sacralization, but the effect of the sacralization we could minimize that, and the intensity of pain definitely comes down, and you can have a beautiful quality of life without compromising in your daily activity. So one more success story added. Thank you.